Thank you for attending tonight's school immunization webinar. My name is Ruth Price Rollins, and I bring you greetings as president of the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I welcome you to this webinar that is being hosted by our Physical and Mental Health Committee. We hope that this provides you with information to keep yourself and your loved ones safe during this pandemic. I will now turn it over to our Physical and Mental Health Committee to introduce tonight's speakers. Thank you and welcome again.
Thank you, Sora Rollins. Thank you all for joining in. I have the pleasure of introducing our SOAR and speaker for the evening, Dr. Lynn Milliner. Dr. Lynn Milliner is a pediatrician at Metro Health Medical Center and the medical director of the City of Cleveland Department of Public Health. She is a graduate of Case Western Reserve University School of Medicine. She has spent over 2 decades caring for children in our community, offering her medical expertise through service on medical boards and advancing the profession of medicine through research and health policy. We are so fortunate to have you with us this evening. So we're going to go ahead and just get started. So, Sora Lynn, Dr. Milliner, we're learning that fewer children or fewer childhood vaccines have been given during the COVID-19 pandemic. Is there a reason for this?
Yeah, it's actually a very simple reason. And I want to first extend my gratitude to SOAR President and the members and co-chairs of the award-winning Physical and Mental Health Committee. This is an honor and a real treat for me. And I'll give hugs and kisses virtually, but thank you again. And there's a very simple answer to that. We were actually doing very well with immunizations before the pandemic struck. When the pandemic struck, a lot of offices shut down in-person visits. As you know, the least of us is the most vulnerable of us. So very young children did not have intact immune systems. When we stopped doing face-to-face visits, we weren't allowing children, especially young children, to get to the office to get their shots. A lot of doctors would not see their own patients, see their own families, because it wasn't safe to do so. So then when that started to lift, when the governor started to open up practices and hospitals and doctors' offices, we gradually back into that, but guess what? The light bulb came on and we realized that we were woefully behind. The American Academy of Pediatrics has very much put out a huge message saying, now we got to get the kids in and get them caught up. And as you know, those of us who aren't even comfortable going to grocery stores don't even want to take the chance to take our kids to a doctor's office or hospital to get us caught up. So it's going to take us some time to do that, but we're gradually making progress.
Thank you for explaining that. And I imagine as we see that with children, we may also see that in other populations as far as being behind on vaccinations or immunization.
Certainly.
So one of the things that I think we all know or are aware of is that there's a lot of opinions around vaccines and maybe accurate information as well as misinformation that's out there. So can you just explain to us what is a vaccine? How does it help? Are there any risk benefits?
So let me kind of go in order. So a vaccine is what most people think of it as, is a shot that prevents you from getting diseases. Most of the vaccines that we have developed over the years have prevented diseases that even when I trained as a resident could cause life-threatening and serious consequences and diseases and even fatalities. In undeveloped countries and parts of the world, things like measles can be deadly. In this country, as you know, for a time, measles was almost literally completely eradicated. That means if everybody was vaccinated against measles, nobody got measles, you didn't see it. And then lo and behold, people started to opt out of getting vaccines. So now you hear about outbreaks of people that have not been vaccinated. It used to be foreign adoptees would come into this country with shot records that we couldn't verify, that don't have the same immunizations that we have in the United States, and then they would take them to Disney World and expose them to other people who opted out of vaccines, and thus you have outbreaks. This is serious because not just people that don't get the diseases aren't protected, but when you think of what you might expose the public at large to. So if you're a parent and you send your child to school with someone that's not vaccinated and your child is recovering from something like cancer or doesn't have an intact immune system, exposing them to measles could be deadly to them. I'm going to date myself and say that back in the day, we used to have things like chickenpox parties, right? So that's, you would extend everybody to the house. So everybody had chickenpox all at the same time. And believe it or not, we have college students that are doing the same thing with COVID. So, hey, why don't we just have a party and let's all get it together, which doesn't make sense anyway. These are diseases that can cause dire consequences for some people. So that's never wise to do. So what vaccines are, in short, are a way to, I call it like boost. It's kind of like hyperstimulate your immune system, right? So you are protected against getting that disease for life, and sometimes immunity is worn off, so you have to get boosters. The misperceptions of vaccines, you're right. In a day and age where you can Google anything, and people do, whether it's accurate or not, right? So we always tell people you should go to trusted sources like the CDC or the American Medical Association or the Academy of Pediatrics, or the same for family practice for adults. But there's a lot of misinformation. As you know, as a culture and a people, our misperception of the medical system always goes back to Tuskegee, when we felt like we were being treated without our permission, certainly, treated unfairly, unjustly, unknowingly. And we have some of that same mistrust today as far as vaccinations. Recently, there was probably within the last 10 to 15 years where there was the autism risk was linked to a preservative that was in the vaccinations. That preservative has since been removed, but there are still families to this day that I will have to discuss with them that vaccines don't cause autism, and that study was flawed, but you will have a hard time convincing people that. So that would lead me into that discussion about, well, if we get a COVID vaccine, will people get a COVID vaccine? It's really difficult. Back in the day, as you know, when you grew up and your parents grew up, you to your doctor, you listened to your doctor said, do this, do that, and you did it, right? Now that there's all the information out there, people pick and choose what works for them, even when they've been given scientific evidence and data to prove otherwise, but you can exercise the right to refuse a vaccine. But understand that you take your health at risk and you put others at risk as well. I have plenty of families that won't get a flu shot, so I'm pretty sure those same families that won't get flu shots probably won't get COVID vaccines. But vaccines are important. Vaccines save lives. They protect your immune system and they boost your immune system. And children don't have immune systems, they're not born with them. So the importance of getting an immune system that's intact and accurate and works is more important now than it ever was.
Thank you for explaining that. You touched on a number of things that I think we could probably talk for days and days about. But for maybe the sake of this webinar and interest of others, I think some of what you were describing might be defined as what's called or termed vaccine hesitancy. And can you talk a little bit more about what that is? And I'm just very interested in this because as a nurse, I try to stick to what are the recommendations of our trusted sources, as you mentioned. But I have to tell you, I was getting my sticker renewed yesterday, whatever day. And there was a lady behind me and a gentleman, and they were talking about COVID and vaccines. And she said she was a nurse. And I could tell you her views were so far removed from the things that you were stating, but she's talking in line to someone who is listening to her. So do you want to talk a little bit about what vaccine hesitancy is and kind of where maybe
comes
this
from.
starts from.
So I think
Yeah.
historically, people were comfortable with the vaccines, and I'll be honest, I'm not sure when the movement started where people were able to opt out because they felt like it's putting something foreign in my body. You know, I've had families say that. I've had families say, well, you know, I don't think it works. Some people will do every time I get a flu shot, I get the flu. Um, there has been years and years and years of studies done into research about vaccine safety, vaccine effects. Sometimes the hesitancy is fearing common reactions. So, you know, when we give shots to little children, we tell parents, well, your child might be fussy, they may have a little knot, they might have a little fever, they might feel a little achy. It's the same thing when adults get flu shots. That's not an adverse reaction, and we're not giving you the disease, right? We're giving you something to protect and boost your immune system to protect from the disease. And that sounds very scientific, but the general public does not believe that. A lot of them will believe that, you know, we're putting something in your body that you weren't born with. I've had families with that argument, well, if it's not natural and God didn't make it, I don't need to take it. I'm like, well, I you know, do the opposite argument. God gave us vaccines so we could protect you against those diseases. But we are certainly mistrustful of the community. We also don't believe in studies. As you know, part of the hesitancy comes from in developing drug trials, African Americans, people of color weren't included in a lot of those studies. So yes, it is true that we could respond to vaccines differently, just like we respond to medications differently. So getting us to participate in trials is very difficult and very challenging. We think of it as being experimented on. People aren't comfortable with being human guinea pigs. So as you know, if you are on social media or do read the news, you know they're asking for people of color to sign up for clinical trials because we need to know if the vaccine works for us. We need to know how we're going to respond to the vaccine. And the only way to find that information out is to get us to participate in those trials. But the hesitancy is real. I can tell you that there's been a backlash about why you're able to refuse vaccines. So a lot of this movement started in California, actually in upper socioeconomic Caucasian families who said, I don't believe in vaccines, I'm not getting it. And the schools allowed them to opt out until little Buffy and Jody went to Disney World and got measles. And schools decided, you know, now everybody's getting sick, nobody's immunized, we can't shut the school down. So that option is becoming less and less. Ohio is not a state right now that lets you refuse vaccines based on your conscious objection status. But the school can refuse your child, right? So the school can say, well, if your child's not immunized, we don't have to admit them. There may come a time when that's a nationwide mandate, but we're not there yet. So the hesitancy is real, not just for children, but it's just as difficult for adults. I do not dismiss people from my practice if they don't get their children immunized. It's my duty and my job to explain why they're of benefit, but I have to, you know, whether I like it or not, I do honor parents' wishes not to do it, but I encourage them to get their child vaccinated, not just for their child's protection, but for the community's protection as well.
So you just said so much that I that I think we can continue to unpack. Mm-hmm. One of the things you started off saying was that the least of these end up being impacted the worst in situations like this, but also that with the conscious objection that was oftentimes affluent people or well-to-do people or highly educated people. And so it seems as if though there's a lot of groups that may still be, I don't want to either left, they're unvaccinated Correct. For a number of different reasons. So it's a lot to try to wrap your arms around. And I think it's interesting that it becomes the public institutions such as schools or even private in terms of like healthcare organizations or employers, I would say, that are driving that whole push. I know I've heard people say, well, I shouldn't be mandated to get a vaccine. And it's my thought, and you can share what your thoughts are. I try to have that statement that, well, medicine isn't like mandatory. There are exemptions. There are reasons that you might not be able to get something, but what I feel like the pushback is people resist the word mandatory, but they also resist the fact that schools may say, well, but you can't bring your child here. So how do we reconcile that, or what with regard to what the public health and what the stance is from public institutions around?
The whole point of, even having public health departments is to protect, it's almost like the greater good. I can make the very easy segue from mandating vaccines to mandating wearing a mask. Everybody's like, well, you can't tell me or force me to wear a mask if I choose not to. Well, we know that masks do prevent the spread of COVID, right? Maybe not, albeit 100%. And vaccines are the same way. We do agree that vaccines, and we do know that vaccines prevent the spread of disease, right? So it's hard, and it's very difficult in this country when we try to separate, church from state and federal government from schools and parents' rights. So sometimes it's negotiable. I will tell you that parents that give me I don't want my child to have, X number of shots today. And I've actually had people kind of spread it out more. Now that's not ideal or wise, but they're like, well, I want to do the shots, but I don't want to do all the ones at once. Can we stretch this out? I'm even more willing to do that than not let you do it at all, right? And at the end of the day, you're right. So can I force you to do something you don't believe in or you don't want to do? No, I can only give you the science. I can only give you the data, but I can also say you may choose to not wear a mask. You may choose to not vaccinate yourself or your child. But I always say, but I may also choose not to be around you. I may also choose to not put myself at risk because you're putting yourself at risk. I have plenty of families that won't get flu shots as adults, but I say, guess what? You know what? You don't believe in the flu shot, but get it for your child so your child doesn't go over grandma and grandpa's house, give grandma and grandpa pneumonia when you could have vaccinated the child. And then they'll get it that way. And they won't get it themselves as adults, but they'll say like, okay, well, yeah, I could give it to my child so my child doesn't give it to everybody else. Or if there's a newborn in the house, right, who has no immunity. So people, sometimes if you listen to them and find out what to your point, what their hesitancy is, sometimes I've actually been able to have some wonderful conversations about getting them to understand and recognize the importance of vaccines and why we recommend them. Sometimes it's an uncomfortable dialogue. I've had families just be grateful that somebody talked to them as opposed to saying, well, if you don't get it done, I'm not going to see you. And then there's no conversation, right? So I tell them I don't kick them out. I'm like, let's talk about it. Some families we've agreed to disagree. But many of them actually will come to some kind of agreement. And if you want to meet them where they are and do a strategy that works best for them, we're amenable to do that. I will tell you in my heart of hearts, I feel that even if we had a flu vaccine that was perfect for everybody, and even if we had a COVID vaccine, that we're not going to get one before the election, I don't care what anybody says. But if we had a COVID vaccine, I'm not even 100% positive that a lot of us, I think the last data I read was maybe about 50%. There are going to be a lot of people that aren't going to sign up for that one either, right? People talk about herd immunity. Well, shouldn't we just wait for everybody to get it and then we won't need the vaccine? That's going to take a while, right? This is a big country and there's a lot of people in it. And even though a lot of people have COVID, not everybody's going to get it. The whole point of getting the vaccine, as you all know, COVID hits us worse, right? COVID's taken us out. It's not taken out Buffy and Jody and the people that have a lot of money, although it's taken some of them out. But we get it the worst. And same for flu. We get hit the hardest and we get hit the worst because we're not healthy as a people, right? And if you start out not healthy, then getting diseases on top of diseases, it just goes in the wrong direction for you.
Thank you. I saw a question come across the chat, or I think it's a comment from Gladys. It says, did you mean to put this in here, Gladys, where it says cow? Do you have a question about? Oh, so the question is, what situations would you exempt a child from getting a flu shot or other?
So certainly, if now this is probably what strikes fear in the heart of parents, is if you have a severe reaction to a vaccine. So the reason why we do clinical trials in vaccines is to identify every potential side effect and reaction possible, right? So the most serious side effects are really high fevers, heaven forbid seizures. You have what if you think of the garden variety anaphylactic allergic reaction, like the bee sting that everybody fears. So if you have that kind of reaction to an immunization, then you should not be getting immunized. And those, thankfully, are exceedingly rare, but you need to know about them. There are I always remember the names of them, the vaccine safety monitoring events. So if anyone ever has a reaction to a vaccine or an adverse event, that is monitored. It is reported, and it's been reported since the time that vaccines started. So serious health consequences will prevent you from getting vaccines if you have a severe reaction to it. Minor illnesses do not, right? So if your child, or even you as an adult, say you've got a little bit of a cold and runny nose and you're thinking, I really shouldn't get that flu shot. Yes, you should. It's not going to make you sicker as long as you're not sick enough to be hospitalized, the fever's not terribly high, you're not dehydrated. We will immunize you, because part of the issue with getting you immunized is if this is the one day you're in the office and we have the shot and you're feeling okay, that would be the time to get it. Because as you all know, maybe before the pandemic, we were better procrastinators. Now we don't have anything better to do, so you might as well go in and get your tune-ups and get all the things we recommend that you do. But as you know, we still put things off, right? We don't do our yearly screenings, we don't get our shingle shot, we don't get our pneumococcal shots. There's a lot of things we avoid. So when we have you in the office and we're going through that health maintenance checklist to see what you've avoided and what you've missed, that's an ample opportunity, so that even if you didn't come in for that day, we're going to make sure you get it before you leave.
Thank you. I know we have a couple other prepared questions. One of the things that was put in the chat that I actually think is fascinating was a statement saying that the Divine Nine is looking to get into precision medicine, or to focus on precision medicine. And I know we have the Delta Research and Education Foundation that is hoping to recruit more minorities to participate in research, but also to have their genetic information, I don't want to say stored, but that's what I can think of, for lack of a better term. I actually went to a precision medicine nursing conference last year, and it was pretty fascinating, and I could talk more about it, but I think it's just interesting that you bring it up as we talk about the fact that, there's different reactions to vaccines, and that is concerning for parents and others. And the goal around precision medicine is really just trying to get the right treatment to the right patient to, make sure you can get the maximum benefit or the maximum impact. And it's not just medicine that's tailored for Susie person, right, not similar to you. So I don't know, right, what your thoughts are.
That's a good segue to a little bit about clinical trials. So when they do clinical trials, there's, what you're hearing now, everybody hears like, oh, where they're in, phase 3 of clinical trials. How they start out is like phase 1 is a very small number of people. Phase 2 is a larger number. Phase 3 is a larger number. And phase 4, which I'm getting older, and it's been a while since I've been in medical school. Phase 4 is more like precision medicine. So phase 4 is like, once you've got past 3 and you've given it to like hundreds of thousands of people, then you start looking to answer certain questions. So a phase 4 trial might be, would a hypertensive diabetic respond to this vaccine the same way a person with normal blood pressure would? So to your point, once you get to phase 4, it's really trying to answer those questions and tease out, is this vaccine in its current form effective for certain groups or certain ages or certain races or certain health characteristics or certain comorbid conditions? So you really do try to fine tune and tailor it. The challenge for the COVID vaccine is everybody's trying to rush and get a vaccine approved, right? I'll be honest with you, given the vaccine hesitancy, I'm sure there's a certain segment of the population that'll sign up to be the first one to get that vaccine. And I'm sure there's also a segment of the population that's just going to sit back and say like, well, I'm going to let somebody else try that out first, right? Before I jump in that line, right? And as you know, one of the biggest companies right now that's doing a phase 3 has halted their trial because there was an unexpected reaction to the vaccine that was unexpected and unexplained and serious enough to say, well, we're gonna have to pump the brakes on this. And you know, it's almost like we gotta pump the brakes, put it on pause for a little bit and try to figure out why that person had that reaction, right? And it was pretty significant. And that was just one person, right, out of hundreds of thousands. So know that nobody wants to rush a vaccine out there that's going to cause people to be a lot sicker, a lot more debilitated. So you really do have to tread carefully and do the work and do the research and do it the right way, right? We can certainly rush something out there, but nobody wants to put out a substandard product, right? And nobody, you know, wants to put out stuff that's going to cause more problems than more good that it's going to do. So we really do have to be very careful that we do those trials, that we let those trials come to fruition, and we get it out right, and get it out the right way.
Thank you. I know we talked a lot about the COVID-19 vaccine and how that's coming. One of the things that in this webinar we do want to address are the like the vaccine schedule for children and what that looks like, what that means. And I'm hoping you can tell us who are children. Like, is that your kindergartner? Right. Is that someone else?
So initially, people are a little alarmed in the beginning when you get a lot of immunizations to start, because you are literally born with no immunity whatsoever. So the point of loading younger children up with more immunizations is to stimulate your immune response and develop an intact immune system. So it's almost like priming the pump, right? So when children are born, that initial immunization schedule is pretty frequently, and it's always updated on the CDC and all of the major professional organizations' websites. But initially, in a first year of life, vaccinations are given at 2 months, 4 months, 6 months, again at a year. And then fortunately, and parents are probably very happy about this, you get boosters around 15 and 18 months, and then no boosters again until you go into kindergarten. And then the next boosters are not until you're in junior high. Now, back in the day, we used to get a lot of shots. We still give a lot of shots, but thankfully today we do combination immunizations where there are, when parents say, well, what's in that shot? And I rattle off like 4 diseases, but that's in one immunization. More diseases in an immunization doesn't make it a more serious immunization. It's just you're able to get more, I would call it bang for your buck, right? So you're getting fewer shots, but you're protecting against more diseases. And that's always the way I explain it to parents. So while it sounds like a lot, it's really not a lot. It's a lot of diseases, but it's a lot less shots. In a perfect world, we'd get them developed where we'd be able to do it in 1 or 2. But we're not there yet, but at least they've been able to combine a lot of them. And the whole process is like, why do we have to give so many so frequently? It actually has been proven to the more you give at an earlier age, the better protected you are later. Now, you're never too late to start. So even if you decide for some reason your child is not immunized until they're 2 or 4, the CDC does have a catch-up schedule. So the intervals will be less frequent, right? So where they were 2, 4 months, 6 months, we'll do them in as little as 6 weeks just to get you caught up. So it's never too late to start. There are some immunizations you could put off. Most parents come in and get most of them. The ones that tend to be a little controversial that sometimes people aren't comfortable about is the HPV vaccination, although that's gotten better. When that one first came out, people were like, well, I don't want to think about that. And you have time to get that. So I'll tell families, I'm like, well, your child can get that when they're 18 and they can make up their own mind. But so think of it as a lot more in the beginning to prime the pump. And then as your pump is primed and ready to go, you only need booster immunizations and they're far less frequent. Schools, the part of the dilemma now is, I think it worked out well that a lot of schools are doing remote learning so that those are behind on their vaccinations have time to get caught up before they actually go back to in school. And that, as you know, that's a moving target. Some of them are already in school. Some of them are still doing remote learning. Some of them are doing a hybrid. So we do have time to get caught up. The ideal would be to have everybody vaccinated when that first day of school starts and everybody's ready to go. And schools have done a pretty good job of trying to be patient with families to allow them to get caught up in the time of the pandemic. And even if it wasn't the pandemic, they do give you some leeway to make sure you get caught up.
Thank you. One of the things that I have learned of recently as it relates to the schools as we work with the public health department was around a deadline that children or parents have to ensure that their children are immunized according to the schedule. Can you talk about what that is and if it looks different during COVID to your knowledge?
It doesn't look different during COVID, as far as I know. I think the big push this year, though, will be we're going to be mandating flu shots like never before. We've usually allowed, families to opt out of that. We're probably going to be less, not kind and gentle about it, but we really want to push for that. As much as we know about things like COVID, there's a lot we don't know. You have to think about giving vaccines. Really, at the end of the day, you're giving an immunization to someone who's healthy as opposed to giving medicine to someone who's sick, right? So the point of getting the immunization while you're healthy is to boost your immune system to protect you in the future while you have that opportunity. The last thing we want for anybody this season coming up is to get flu and COVID at the same time, right? We know that flu takes us out, COVID takes us out, flu and COVID will really take us out, right? And the whole point for school children being deadline, because in the summer, you're, exposed to your relatives, to your friends. In the school, when school starts, you're exposed to a lot of other people. So the whole deadline around getting them immunized before they go back to school is to protect the community, in the school environment and the public at large. I call schools and daycare as the hotbed of infectious disease. Your child lived at home all day and was never exposed to anybody else. The minute they hit that daycare, the minute they're in that kindergarten and that snotty kid next to them is touching stuff and rubbing stuff and touching other stuff and rubbing other stuff and sneezing and coughing, and don't have parents that teach them to wipe and cough into your sleeve and not your hand and not touch me and not do all of that. In a perfect world, then it wouldn't be that hotbed of disease. So the whole point of getting them on that deadline is so that they're protected from themselves, basically, and then protecting other children and protecting their families when they go home. Immunizations and flu and colds and whatnot, the biggest issue is, you come to school, you get that, and then you take that home, right? So if you didn't start with it, you get to school, you get it, and then you take it home, and then you give it to everybody else. So the whole point of sticking to those deadlines is to try to prevent that and nip that in the bud before it becomes a bigger problem.
And as far as the deadlines around schools, are we talking about private schools, or are we talking about?
I think it's universal. I don't think private schools are any different. The thing that made private schools more tricky is some of those places are more the ones that would, let parents say like, well, I don't believe in vaccines because I think they cause autism and I'm not going to do it. But they're held to the same standards. So if that private mandated that if that child's not immunized, we're not going to take them. And I think you're going to see more of that. in light of the pandemic, because part of it, we have a healthy fear of the pandemic, but we also have, an irrational, not well-grounded in fact kind of fear of the pandemic. So, somebody will sneeze and the teacher's going to send them home because I'm like, well, you should get tested for COVID. I'm like, well, it's probably allergies. So I think we're going to have a hard time kind of settling that down in the near future, but the deadlines are the same for everybody. And I don't think private schools have a different standard or a different deadline. I think it's really just to try to get them protected before they start school and before they get a lot of exposure that they don't. Because if you think of it, once you go back to school, then you are just more likely to be more exposed to the kids that aren't vaccinated, right? Because you do keep your kids, at least now in the COVID era, nobody's going anywhere. Nobody's going to the park, nobody's going to the zoo. You're not out in public. Well, there are still people doing that, but not as much as you used to, right? So the whole point of getting that shot series done before school starts so that when they get exposed to the larger population, you do get the effect of things like herd immunity and a more safe and protected population so that it's less of a risk for your child and your family.
Thank you. I hadn't heard that private schools had the same standards or could have the same standards, but I'm glad you explained that. Where can the community go to get vaccinations? Where in the community?
Right. So if you, so thankfully the public health department is starting to roll out their vaccine clinics. So I think when COVID was, well, it's still its prime, but when it first hit, there was probably like a delay in getting vaccines delivered. They were certainly ordered because we started ordering those, say, for the fall school cycle back in the spring. So there was some delay in getting all of the vaccines in. So we do have a good, healthy supply. If your child has a regular provider, providers should have them. For those people who say can't get in to see their primary care provider, some of the retail clinics will do vaccinations. I believe the insurance structure is different. Sometimes you may have to pay out of pocket and then you can submit that to your insurance company. The local health departments will start doing vaccine clinics, not just children's immunizations, but flu as well. Flu is just starting to come in. I know the retail clinics have it. The major hospital systems are starting to get theirs. And the local health departments will also have flu vaccines as well. So they're trickling in, so there's opportunities. If you have the internet and you can guide families to the public health department's website, Cuyahoga or Cleveland, and they will let you know where their vaccine clinics are held. Some of them have sliding scales, some of them may be free. As you know, some of them are government and insurance funded. So access to care is huge. So we work very hard to make sure that vaccines are available and readily accessible for everyone that needs to get that vaccine that can get it.
Thank you. I wanted to invite those that are participating in the call to, you can feel free, I think it's a small enough group, you can feel free to unmute if you have any other questions or thoughts that you want to bring up or get some opinion answers from Dr. Milliner while we have her time.
Right. Y'all call me Dr. Lynn as Sharon does. That would be fine, or just call me Lynn. I can answer any question except the winning lottery numbers because I don't have those yet. But I'm happy to I'm happy to answer anything.
Well, Dr. Lynn, first of all, thank you for that information. Even though I'm retired, I still want to know. And I was surprised when I started listening to the webinars presented by the Divine Nine, how much effort and thought is being put into precision medicine. And then I learned about what was put into place in April, I guess, in 2011, working with the World Health Organization to start looking at precision medicine. I didn't know anything about any of that. Mm-hmm. And so I'm kind of geeked up and interested as I study some more, but the Divine Nine had, I think, about 4 or 5 webinars on precision medicine. So I'm learning something new besides just being able to rub elbows with Dr. Lynn so I can learn new things.
Say the nicest things. What I love about precision medicine, we have to recognize that we as a people have a different, to Sora Kalia's point, we have a different genetic makeup, right? So we don't respond to medicines the same way. We don't respond to vaccines the same way. I think we learned a lot of this basically in hypertensive research when we found out what meds worked best for African Americans, people of color, and what medicines work better for the Caucasian population. We all universally can't take the same medicines for our blood pressure, right? We metabolize, and that metabolize means how we break down the drugs that we take. We do that differently, right? So in order to best use those medicines, it can't be cookie cutter. I think the downside is what we're trained in medical school is, you know, everybody with the same condition gets the same treatment. That's not going to work going forward. We realize that everybody doesn't respond. So I sometimes will tell families that medicine is just as much art as it is science. The foundation is certainly science, but the art of it is tweaking it to work best what works for that population, or even, you know, hopefully down to an individual level, because that's where the heart of it is, right? So, you know, we'll get people coming all the time. Well, you know, that antibiotic didn't work for me, that painkiller doesn't work for me, or my aunt took this, or my cousin took that, and none of that works for me. So the challenge is going to be what works for you individually, and then what works for certain groups, right? So we're getting there. We're getting there. It's exciting to be in medicine at this time because there's a lot that we don't know. As you alluded, I take the COVID hotline calls, and the knowledge that I've gained in terms of infectious disease management and even just information about COVID. If you had told me at the beginning of the year that I would be one of the COVID experts at our hospital system, I would have been like, yeah, sure. But I've done over 2,000 hotline calls. And I've learned that we know a lot. I've learned that we still have a lot to learn. Right? And what do they say there? You know, you should learn something new every day. This is one of those who truly, I do learn something new every day. And precision medicine opens up exciting opportunities. And if we could get past our you know, fundamental distrust of some of the things in medicine, we're going to be a long way. I went to the NMA virtual meeting a few weeks ago, and I will tell you that Tuskegee is still out there and it's still real, right? So you're unfortunately going to have a lot of people that are still going to hang on to that, but they're going to have people that are like you that are participating on this call that see a wonderful new horizon for how we view medicine. And recognizing that we are just as important and just as valuable as people to contribute to, you know, the development of medicine.
Other questions from those on the call?
So Lynn, you mentioned something that struck home with me. And I am amongst those who is not going to be first in line for a vaccine. Mm-hmm. And I think that coming from the pharmaceutical industry and realizing what it really takes to get something approved, I am very, very hesitant about something that's being pushed through like that.
Right, right.
And you know what? Trump could be the first one to get it, you know.
Absolutely. Oh, as he
But
should, as he should. He should be number one.
but we all know that he won't. He won't even wear a mask, so he's not going to
Right.
be number one to get, you know, something that he pushed through in a
No,
matter of minutes, you know.
definitely not.
And but I am very, very skeptical of that. And until I see at least a phase 3 and the results from it, I'm not going to be standing in line. So you all may never see me out in public again. I don't know.
You know, I'm the same way. I have very good friends who've signed up for clinical trials, and that's why, because clinical trials means you either get the you
The
know
placebo.
the placebo, right? You could get the placebo, so you may get something that's not even you may get that little water shot, right? So you
Right,
may not
right.
be getting real medicine. But I'm with you. So I am equally reluctant to be first in line, especially for something that's pushed through. What you want to do, if that's where you are, is certainly get on those websites where it's the vaccine safety monitoring, because you want to see what kind of reactions are out there. I did hear, I think as recently as last week, when they were developing the vaccine for the last SARS infection, right? So what they found was they were working on a vaccine, but some of the vaccines that they came up with were actually making people sicker than the actual disease. That's not what we want to do. And that's, you know, on the reactions that, and you all, you know, I always laugh about it. People say, well, you know, I get a flu shot, I get the flu. We can't get a vaccine that's going to make you sicker than actually having the disease. Most people won't get it. And I couldn't agree with you more. If you rush to get it out, as you know, as you said, you know, it took years to get medicines developed and approved, right? So the fact that you want to do this in what, 3 months or less, or 6 months or less, sometimes the downside is some of those effects and lasting effects don't come out for years, right? So
That's
I don't.
right.
I'm with you. I'm not as willing to be a guinea pig. I want to get out there and get some of the kinks worked out. And I will get it. I'll be socially responsible and get it. But I won't be first in line either. You know, there's some people want to take that for the team. I'll be happy to let them take that for the team.
And you know, you also spoke to the fact that, and I've been hearing a lot of this, and a lot of concern that the flu season is upon us on top of COVID.
Yeah.
And my line of thinking is that the flu season may not be as bad as we anticipate, because we're taking all of the precautions with COVID that perhaps we should have been taking with the flu in the beginning.
That is
And
our
so,
hope.
yeah, yeah.
Yeah, you're right.
And so if you're doing the hand washing and the sanitizing and wearing the mask and that kind of thing, it may actually inhibit, you know, getting the flu on top of, you know, a flu shot.
Right.
But that's kind of my line of thinking. Am I off there?
No, you're not off. What we're thinking in some respects is that there may not be as much prevalence, and that's the number of people that have the flu, because not only are we, you know, masking and cleansing, but we're not going anywhere, right?
Right.
So we're not having in-person sorority meetings, and we're not having, now, there are people that still do gatherings, you know, we prefer not to. But I think a lot of that exposure is probably going to be less. Good news is what we're hoping to do is develop a test that tests for both COVID and flu at the same time, because right now they're two separate tests, right? So, you know, I guess one nose would be flu and the other nose would be COVID, but they are trying to work on a rapid test that will test both. At the end of the day, I think if we were in a perfect world, if we could antibody test everybody at the end of, maybe not this year or next year, most of us will have had antibodies and been exposed to COVID, right? I think the fear is that we worry that when we get it, if we have underlying conditions, that it's going to be really bad for us. Thankfully, like the flu, most people that get it recover, although some people will have lingering effects from it, right? Not so much for the flu. But we're hoping that you know, it's not as bad this year. And I think you're right. I think all the things we're doing to protect us from COVID, and here's the caveat, if we continue to do those things, then I think we'll come out much better in the upcoming flu season. But we still have to, not that I love him, but, we still have to stay the course, we still got to do all those things that we've been doing, as painful as it is, until we get through this winter, right?
Mm-hmm.
And I'm saying that we can take our foot off the gas, but, we got to get through the next few months. They're going to be challenging as well.
Mm-hmm.
So one other thing, ironically, the Congressional Black Caucus has their annual legislative conference this time every year, and it's virtual now. So what's on their schedule for today at 11 o'clock? Of course, I'm sure they're archived. Petri dish politics, addressing and moving beyond medical mistrust in the Black community.
Yeah.
So
and it started out last week. Well, yeah, so we should watch it. The first one they did was, how do we get literally like Black people to get vaccinated?
Yeah. Yeah.
They talked about vaccine safety. They talked about all the trials of vaccines, but we really do have to get past this misperception. I think it's a double-edged sword, right? So what we're trying to tell people is vaccines are safe, they're studied, where they're studied rigorously, and then you have, on the other hand, we got to get this vaccine out as fast as we can. So it sends a double message, right? So we want them to put the work in, we want them to study, but we want to feel comfortable that they're doing the appropriate amount of study, the appropriate amount of investigation, and the monitoring is actually worlds away from what it was when they first started. But if we don't let them get it out and get it out right, then to your point, Sharon, I only think it's going to heighten the mistrust that we have, right? So making sure we do it in the appropriate way and don't knuckle under the pressure to get it out sooner when it's not ready, we should be okay. But we will always have to try to counter that mistrust, that hesitancy, and that reluctance to even participate in trials, let alone get it when it actually does come out.
So I have another question. Why is it that if you're more than 26 years old, you have to get a double-powered flu shot as opposed to a regular one?
I believe so the good news with flu shots is once you get them, they're effective. The bad news with flu shots is not proactive, right? So every year we base the upcoming flu shot on what was the strain last year, right? So if one year it was H1N1, then when we do the upcoming vaccine, we're going to put all this H1N1 in the vaccine. And then we don't have H1N1 this year. So part of doing the double, if you're of a certain age, right? Of a certain age, we look good at a certain age.
Yes.
To protect you against more of those strains that may be prevalent because we can't predict it. I mean, so when you hear, I think last year it was in Australia and New Zealand where the flu shot that they had was only like 33% effective. That wasn't true in the United States, but the issue was the one that they picked, right, to be in the vaccine just wasn't the strain they were seeing.
Mm-hmm.
Always going to face that. So part of it, when you get of a certain age, the reason why they do the double whammy is the complication of flu for us is pneumonia, right? And pneumonia is what will take you out for a while, right? So giving you a double dose, a double strength of the vaccine, not only protects you against the strains that are out there, but protects you from getting pneumonia, which can be, a much more serious illness and a much more longer lasting illness.
So are you recommending both flu and pneumonia shots?
Absolutely, because I believe pneumonia is over 65 unless, right, you have health conditions that would get it done for you sooner. Yes, you should do the double strength flu shot, especially now, because anything you can do to prevent you from getting the flu and COVID, you should absolutely do, right?
Well, they don't give you a choice either.
No, they don't. They don't, and that's a good thing. You know what? I think part of our dilemma is we have too much choice, right? We didn't have choice, then we wouldn't be able to opt out of it.
Right, right.
So we have just a few more minutes left before we wrap up. This is been really good discussion. Does anyone else have questions for Sora Lynn or that they want to bring forward or comments?
Well, I just want to, take a moment to thank all of you that participated. I know you all, and I couldn't be happier that you took time out of your busy schedule. You took time out of your schedule this evening to do this, and we'll do it again. I think it's important that you have forums that you can get information out in a way that I hope was not too technologically complicated, because I am one who really likes to keep it real and on a level. I am very real and upfront with my patients. I'm also fun with my patients, not just because they're children, but even the older ones too. I believe a sense of humor and a sense of prayer and dignity and grace and just wanting to do the right thing for everyone will carry us through. I am at your beck and call and happy to be a resource. This is wonderful for me. I love to do this. I don't get to do enough of this. I get talked out in other ways, but this has been an absolute joy. And I am certainly willing and able and would love to do more of this because it's important. Sometimes we can't get information the way other people do, and I want us to get the right information. I tell people all the time, that get nervous about, well, I read this and I saw that and I heard that. I'm like, first of all, you need to lessen your choices, right? Because you will read all of that stuff and you'll be more confused. So whatever source of health information you get, it is not necessarily CNN, but it's also not Fox News, but that you limit your sources, that you get trusted information, and you ask a lot of questions. The only, ridiculous question is the question that's not asked. And believe me, if you have that question, other people do too. And you don't always have access to information that's correct, accurate, or up to date. So I'm here for you. We're here for you. We're going to get through this together if everybody continues to do the right thing. And please, Sora, I just say, wear your mask, stay home, and wash your hands an awful lot.